6 months ago, doctors were performing pediatric heart surgery when a Russian missile struck a neighbouring building within Ukraine's biggest children's hospital. Vadim Tukachuk heads up the cardiology centre's intensive care unit.
I remember the ceiling falling down on me, the square panels. But then the first thoughts are always about patients, making sure that at least part of the unit remains functioning normally.
Now his team perform complicated operations on some of the country's tiniest patients in a temporary location in Kyiv, with half the space and without some specific paediatric equipment. Despite these limitations, they were able to perform life-saving surgery on Veronica, who was born 4 months prematurely. Her mother, Angelina Shevchuk.
The surgery posed many possible risks because my baby is very small. I gave birth to her at 24 weeks. Despite this, she's getting better, gaining weight.
While air raid sirens go off, the centre's general director Ilya Yemets and the team continue to treat their small, vulnerable patients.
Women keep bearing babies as before. The conditions for our work have become much worse, 100%. The number of patients is the same as in the previous building, but we keep working in those more difficult conditions without turning back any of the patients.
Over 1,900 medical facilities at 715 hospitals and clinics have been damaged during the war, according to Ukraine's health ministry. Even though conditions are far from ideal, Veronica's mother Shevchuk is confident in a temporary centre.
If it weren't for centers and doctors like these, I think many children would have died.